So for this real-world study of belantamab mafodotin, we used the Flatiron Health database. We included 184 patients who were treated on then commercial belantamab. We saw that they were pretty heavily pretreated. They had in general 5 prior lines of therapy, and around 80% were triple class refractory. What we saw was that the outcome was similar to the DREAMM-2 single agent study, with around 25% had an overall response rate, so PRs and VGPRs. And then the other thing was that we saw with belantamab mafodotin, of course, you have the ocular toxicity. And the ocular toxicity, the adverse events in the real world, was similar to what we saw in the DREAMM-2 study as well. So for the ocular toxicity, we saw that even the adverse events in the real world, they were similar to what we saw in DREAMM-2. So we did see that patients did develop keratopathy, they did develop blurry vision, but a lot of patients, they could still continue on the drug after dose holds and dose reductions. And we saw that the compliance with the ocular assessments were high. So around 90% of patients did see an ophthalmologist even before they're starting their dose as well. So we did see overall that belantamab mafodotin, the patients that were treated in the real world, had a similar outcomes and similar rate of adverse events as in the DREAMM-2 study.